Welcome to Intro to PTA. We're going to go ahead and find the Acromion process as my patient touches her nose.
Sorry.
We'll also find the spine of the scapula, but before we're able to do that, we have to get consent. May I place my hands on your shoulders?
Yes, you can.
To start, we'll start with the Acromion process, which is typically on the top of your shoulder. You can go ahead and feel the little ridges right there. To find the spine of the scapula, you just go ahead and go from the Acromion process down, and you'll feel it. You'll feel that little ridge if you move your fingers. If you keep on following it, you'll end up at the end of the spine, and you can feel the ridges where it ends as well. If I have my patient put her hand on her back, you can see her scapula, and you can also semi-see her spine. Once you hit the end, if you move a little forward, you'll see the superior angle of the scapula, which is right here. If you follow down, you'll follow the medial border, which you can see it. If you keep on following down the medial border, which is right here, you'll end up in her inferior angle. You can also see the angle be right there. If you continue from the angle down, you'll end up following up to her lateral border of the scapula. You can see it on some patients. Now, to do the infraspinous fossa is from the spine. You can start from the acromion, follow the spine all the way to the end. You follow the medial border, and then from the medial angle all the way to the top of her spine is her fossa. Anywhere right here. To go ahead and do her supraspinosa fossa, you start from the acromion. You can go down to her spine of the scapula and just tilt up. Right here will be the supraspinosa fossa.
Hey guys.
We're going to do the acromion, the clavicle, the acromioclavicular joint, the sternoclavicular joint, the coracoid process, and the deltoid tuberosity. So we're going to start with the acromion. On our last video, we showed you where to see it and also where to feel it. Before you go ahead and touch your patient, make sure you get consent. May I place my hands on your shoulders?
Yes, you can.
Once you get consent, the acromion on top of your shoulder, you can feel it. Once you go to the clavicle, you go from the acromion down to the clavicle. You can see it on her, but some patients are different. When you go from the acromion down to the clavicle, you can feel it all the way to your sternum. So this would be your clavicle. To go into the acromioclavicular joint, you go from the acromion down to the clavicle, and then right here would be your AC joint. Going down, keep following the clavicle, you'll end up at the end of it towards the sternum. Right here will be your SC joint. For the coracoid process, the easiest way is to wrap your hand around her and then dig into her right here. You'll feel it. For the deltoid tuberosity, we have one going here, we have one in the middle, and then one going back. They all meet up in one point, which will be right here.
And we're back.
So now we're going to do the greater tubercle and the lesser tubercle. So to find the greater tubercle, you start from your acromion, you go down to your acromion tip, which is not far. Once you go from the tip, it's just a small little indentation right here to get to her greater tubercle, and you can feel it. If I ask my patient to rotate her arm, you can feel that little ridge for the greater. Once you do the greater, the lesser is right next to it. It'll be very close. If she rotates, you can feel it. You can feel a little indentation, and then you can feel the start of the lesser tubercle.